Greetings to all, and welcome to our podcast sponsored by Mr. Alex Jean Francois and Steve and company. My name is Dr. Ducheine, Ivan Ducheine. I'm a general surgeon in New Jersey. Also, I'm the owner of a med spa, Elegant Aesthetic Solutions Health Spa. And today we're going to be talking about health in general. Health is something that many of us take for granted until we don't feel well. We're going to talk about what determines good health and what are the components of good health. For example, when we're talking about health, we usually talk about what we inherit from our parents. It's determined by what we inherit from our parents, what we call genetic inheritance, and from our environment. That is, when we look at where we live, all these things affect our health. That is, when we talk about the determinants of health, we talk about inheritance and genetic. Again, we're talking about sex, gender, and environmental. We're talking about where we live. We're talking about if we live close to a chemical factory versus if we live in a very wealthy neighborhood. Now, where we live has three things that influence our health. We talked about access to healthcare. That is, when we need to maintain or when we are in need of healthcare, access is a very important thing to determine our state of health. Quality of health. That is, when we live in rural Mississippi or Alabama versus living in the Upper East Side of New York, where you have Weill Cornell Medical Center, NYU Langone Medical Center, and Memorial Sloan and Kettering, all these things, they don't reflect the same quality. And of course, cost. The ability to afford good health care is a very important determinant as to how well we live. So, to reiterate, healthcare or correction, our level of health is determined by what we inherit from our parents and also by our environment. To maintain our health now, we mainly need to focus on prevention. That is, we look at in our environment what things we can do to help us maintain our health. Prevention has to do with lifestyle, that is, diet, exercise, and also taking precaution as to not endanger our health in terms of activities that we do. So prevention is key in terms of health. And a lot of the methods that will affect prevention is what we call education. That is, the more educated we are, especially in matters of healthcare, chances are the more we'll be able to prevent what we call the chronic diseases. Also, environmental determinant of health is cultural beliefs. Cultural has to do, the first thing that has to do with culture is language. Second thing is music and food. Food, for example, one of the best diets that people talk about that affects longevity is the Mediterranean diet. And that diet is known to be high in good fat, what we call omega-3 fatty acid. For example, it's very high in seafood, low in meat, red meat, and high in fruits and vegetable nuts. So diet is very, very important, and it's an aspect of culture, which also influences health. So along with cultural belief, we talk about at home, safety at home. That is, we have to have certain things at home that make sure that we're in good health. For example, we have to make sure that particular certain chemicals that we use to clean the house are stored away, and also we don't live on or next to a toxic dump site or an environment that is detrimental under power lines and so on. So location in terms of the home is also very important in terms of determining the healthcare, our healthcare. And personally, nutrition and lifestyle. We talked about nutrition in terms of cultural, but our own nutrition as we get more educated. To the extent possible, it's been shown that if we go towards a more vegetarian nutrition, it's a much more healthier way to live. That is, if we look at a vegetarian versus a carnivore, people that eat lots of meat, vegetarians tend to be in better health. For example, the factors that cause cardiovascular disease that we're going to talk about, the factors that affect heart disease, the fats that we eat, the cholesterol that we eat. Vegans don't have that problem because, first of all, plants don't make cholesterol. They don't have the enzymes to make cholesterol. So, therefore, chances are vegans will not be affected by cholesterol disease. Chances are, but of course, if they overdo certain things, they can also have cholesterol problems. Now, we also talk about behavior modification, exercise, very, very important. It's been shown that for exercise to be beneficial, you have to do a half hour of exercise at least 3 times a week. And during that half hour, for a minimum between 10 and 20 minutes, your heart rate must be above 100 beats per minute. In other words, you must stress yourself a little bit for that exercise to be beneficial. So, in terms of health maintenance, we talk about prevention. Prevention has to do with environment, education, cultural beliefs. Cultural beliefs has to do with location, and location also means geographic location. And we talked about safety in the home, personal nutrition, lifestyle, behavior modification. These are, again, very important determinants of our health maintenance. Now, when we look at the U.S. population, or really U.S. population as an example of most, but not all, industrial societies, when we look at the most common reasons people go to visit physicians or visit their primary care or nurse practitioners, their healthcare providers, the 10 most common diagnoses that are recorded in the U.S. The 10 most common diagnoses are hypertension, upper respiratory tract infection, depression or anxiety, back pain. Number 5 is routine healthcare, that is, you go in to check to make sure everything's in order. Number 6 is arthritis, everything having to do with bones but not the back. Dermatitis, skin problems. Otitis, which is an ear infection. And number 9 is diabetes, and number 10 is cough. That is, upper respiratory is number 10, especially after the pandemic of 2020, COVID. We know that upper respiratory is very, very common. Now, these are the most common reason people visit their healthcare provider, whether that healthcare provider is a nurse, a physician, or physician assistant. These are the most common diagnoses. So, and that is very different from the 10 most common causes of death in the United States. Death in the United States usually comes because of chronic diseases. And a lot of that has to do with your age. That is, if you're less than 10, the 10 most common causes of death will be different than when you're in your 20s, in your 30s, 40s, 50s, 60s, and when you 70s and 80s. That is, depending on the decade that you're in, your causes of death will be different. But when we pull everybody together, mainly talking about adults, the 10 most common causes of death in the United States, number 1 is heart disease. Between heart attacks, cholesterol, cardiovascular disease, heart disease is number 1 cause of death in the United States. Number 2, cancer. When we talk about cancer, we talk about skin cancer, lung cancer, especially in people who smoke. Number 3 would be prostate in men, breast in women, and pancreatic cancer, colon cancer, and the rest. So cancer is number 2 cause of death in the United States. I'm sure many of us know someone who has died from cancer recently. And number 3, the third most common cause of death as of 2022. The data that I have is from 2022 from the CDC. They have not come up with, I guess, calculating the 2023 data has not been finalized yet. So this is the latest I can find from the CDC. So Number three cause of death in the United States is COVID 19 and COVID 19 related diseases. We knew that in 2020 and 2021, COVID took approximately 2 million, caused 2 million deaths in the United States. And there's the COVID where the people died within a relatively short period of time. And there's long COVID. And COVID also caused some indirect deaths. That is, people have COVID and the other symptoms manifested. For example, we know that a lot of people, the first manifestation of COVID was a stroke, a heart attack. So, but COVID is the number third cause of death in the United States. And I'm sure with time, maybe 10 years from now, that will change. But COVID is number three as of current. Number four, accidents. And accidents are mainly in the younger people. Younger people, accidents are very common because younger people tend to be a little less careful than older people. And so we see accidents and number four. And this really is related to mainly urban situations. We see accidents more in urban situations than rural per se. But accidents is number four. Number five is stroke, cerebrovascular diseases. Now, stroke, just like accidents, was more common in younger people. Stroke is more common in older people. And we're talking about older people, we usually mean 50 or older. It's as you pass 50, your incidence of getting a stroke is much more than when you were younger. It's not to say that younger people don't get strokes, because a lot of the reasons for which young people get strokes are very different from older people. But strokes is usually a consequence of hypertension or what we call arteriovenous malformation and a couple of other problems. But mostly you see hypertension in older people, not so much younger people. So hence you'll see heart disease and strokes in older people. Number six is chronic respiratory diseases between asthma, emphysema, pneumonia, bronchitis. Pneumonia is not necessarily chronic, or not probably replaced by long COVID, but asthma, emphysema, bronchitis, these are, when we think of chronic respiratory diseases, these are the ones that come to mind. And they are number seven in terms of chronic diseases that for which people die. So the first one is heart disease, second one is cancer, third one is COVID, accidents number four, stroke number five, respiratory disease number six, and number seven is Alzheimer's. That is Alzheimer's as an index of what we call senile dementia. As we get older, as soon as you hit 40s and 50s, you become a little bit more forgetful. Sometimes I'm sure people who are in their 40s and 50s can identify you going from one room to another. When you get to the other room, you ask yourself, okay, why am I in this room again? And that's something that also happens to me, and it starts to be even more frequent once I pass 55. But it started occurring earlier, but it was not as noticeable as once I passed 55. So Alzheimer's is what we call cognitive decline. Alzheimer's is one type. There's senile dementia, there's multi-infarct dementia, there's a Parkinson's. All these have a psychiatric or mental component to them, but as we get older, these become more frequent. So Alzheimer's is, we said, number seven. Number eight is diabetes. Again, we're talking about the 10 most common causes of death in the United States. Diabetes is, again, number eight. And not so much, it's really what diabetes causes. That is, if you've had diabetes for a long time, usually they used to say every 10 years there's an organ system affected by diabetes, whether it's your circulation, your eyes, your heart, your brain. Every 10 years, diabetes affects a system in your body. So although now there's been some progress, especially with the whole what we call metabolic syndrome, where you have diabetes, hypertension, obesity, these three, and hypercholesterolism, these three problems form this metabolic syndrome, although there's been some progress, especially with the new drugs, that is the semaglutides. Uh, but the fact that diabetes is part of that syndrome um, is still a very important cause of death. Um, Chronic liver disease and cirrhosis. Chronic liver disease is usually some untreated, many times due by untreated infection. That is whether you have hepatitis A, hepatitis B, hepatitis C, or sometimes now, especially with the metabolic syndrome, you have chronic fatty hepatitis. Hepatitis meaning inflammation of the liver. Fatty hepatitis, people who again eat a lot, they accumulate a lot of fat in the liver, and this fat can start reacting, cause inflammation, and cause fibrosis. And and this fibrosis can progress. Fibrosis, again, inflammation, can progress to form cirrhosis. So, and notwithstanding people who are doing a lot of illicit substances, sometimes they get infections in the liver, and all these things can lead to chronic liver disease and also death. Um, Number 10 are kidneys. Their inflammation of the kidneys called nephritis or uh, nephrotic syndrome and nephrosis. All these diseases of the kidney are or can lead to death, especially as you get older. And then to reiterate, the 10 most common causes of death are age dependent. The 10 most common causes of people who are younger that will kill or that will cause the demise of young people are usually different than those that will cause the demise of people elderly. And these causes of death are different than the reason for which most people go to the doctor. That is, I go to the doctor for a particular diagnosis, but they're similar but different from the most likely what will cause me to die in the future. Now, let's get back to exactly our initial talk, which was the definition. We're talking about health, and health has a mental aspect and it has a physical aspect. And beside the mental aspect, we said that it's determined by your environment, and also the physical aspect is also determined by your environment and also your inheritance. Now, we started talking about again the socio-economic determinants of health. That is based on the ability, your access to good health care, the quality of good health care, and the costs associated with good health care. That also will determine basically your state of health. And many sociologists, many public health individuals will tell you that if you give them the zip code, they will tell you how long you will live on average. And again, that's how where we started, where we said that if you live in rural Alabama, chances are you will not do as well as someone that lives on the upper east side or upper west side of Manhattan. We're talking about, no money versus old money, or even if you live on Billionaires Row. So all these things are very, very important in terms of determining health. Now, mental health is related to your social and emotional well-being of people and the communities with which they live. It has to do with our psychological, emotional, and social well-being. Mental health affects how we act, how we think, how we feel, and also helps determine how we handle stress, how we relate to others, even how we make choices. That is, we know that especially in people who are depressed, a lot of people, a lot of physicians will tell you that the metabolic syndrome, will, that is, when people are obese and they usually have high blood pressure, diabetes, and hypercholesterol, most of these people have an underlying depression. That is, they have some issues in terms of the way they deal with stress. And the only way, or one of the most important ways that makes them feel good is when they eat. So they want to feel good. They tend to consume what is closest to them. So, and this thing tends to again, be a vicious cycle. They feel bad, they eat more, it gets them more obese, and again, the vicious cycle. And we know that a lot of people, when they're heartbroken, they tend to consume chocolate, or again, things that feel good. So the idea is depression makes people feel bad, and to feel a little bit better, they tend to eat. So now, to define physical health, physical health has to do with your body, not so much your mind or your thoughts, but it has to do with your body. And it's how well your body can perform its daily tasks. It can be influenced by your lifestyle factors. We already mentioned some of them: nutrition, diet, physical activity, even sexual activity, uh, sleep, and medical condition. And physical health, a lot of it, as we mentioned, is influenced by mental wellness. That is your mental predisposition to do the things that will keep you healthy. Predisposition to see a doctor, to stick with the diet, to exercise regularly, and how to deal with stress, anxiety, depression, and anger. All these things can influence your physical health. So you could think that, as you already know, mental and physical complement each other. To be in good mental health, you gotta be in good physical health. To be in good physical health, you gotta be in good mental health. So these two things are very, very important. Now, what are the ways that we can improve physical health? We already mentioned a couple that you have to do, and we talked about lifestyle and behavior modification. The Let's start with exercise. Exercise is key, that we mentioned already, and we mentioned that you gotta exercise a minimum of three um, times a week for half hour, and get your heart rate above 100 for at least 10 minutes. You gotta eat a healthy diet, very, very important. We talked about the Mediterranean diet. Try as much as possible to eat more fruit and vegetables, leaning towards a more vegetarian diet than a carnivorous diet, eating meat. You have to get enough sleep. Even though we're adults, a lot of us are insomniacs. But the fact that you're in bed, you're resting your body has to rest. Sometimes your mind is ready to get up and not rest, but your body has to rest. Adults need 8 hours of sleep. Very important. Manage your stress and avoid harmful habits. We know the harmful habits: the alcohol, the smoking, and other addictive habits. So, if you manage these things, you should be able to obtain your physical health and also get good mental health. Well, again, thank you very much. Until on our next podcast, this is Dr. Ducheine, accompanied by my staff, Stephen and Alex. Thank you.